Greetings again, and as promised, I want to talk to you about cold sores. We already discussed uh, congestion, nasal congestion, as well as coughing. So I wanted to share with you about cold sores. Next, I'll probably do sore throat. But I had a couple of people who had asked about cold sores, so I'll go ahead and share that. But as always, the information that you're about to receive is for informational purposes only. And it should not be used as any treatment or a substitute for seeking professional or medical advice or even care. Therefore, please consult your physician and or oncologist for guidance related to your specific condition. Although we're not going to talk about cancer in this presentation, eventually we will, and some with any questions that people may have. So I want to go ahead and we mentioned this the last time that, again, there's a true mind-body connection. In GNM, we look at the entire organism or entire body. If someone has a complaint about, say, for example, skin, which is what we're going to talk about today, we don't just look at the skin, the physical symptoms. We look and ask questions about the entire psyche. So that's basically how GNM sees it, the psyche, the brain, and the organ as one unit. So the five biological laws, we mentioned that there is a previous presentation that I just did about maybe a week ago, only 15 minutes. And towards the end, I'll share with you that I have another presentation where I'm going to go into greater details on the five biological laws. But just know that every symptom, or I'll say every sickness, disease, cancer that we have is related to emotional distress. If you can rule out poison, severe malnutrition, as well as accidents, in some cases we can still assist with accidents, know that everything else is due to a conflict shock or something that caught us off guard emotionally. So before we talk about cold sores, we have to really talk, just kind of introduce it by way of discussing separation conflicts. So anything on the epidermis, which is the top layer of skin, no matter where it is, if it's in the hair, dandruff, in the skin, face, back, again, these are all related to a separation conflict. So we always look at the location. So our focus is going to be on again, the cold sore. Okay. So before we talk about that, we have to talk about handedness. So for a person that is born biologically right-handed, the left side of the body pertains to their mother or their child. Okay. So if I have a rash on my elbow, then that means that my separation, a rash is a healing symptom, is related to a separation. And if it's on the outside of the elbow, who is it that I want to push away? My mother or child? If it's on the inside, then they're no longer there for me to hold. So the right side of the body for someone biologically born right-handed pertains to the partner side and basically anyone other than the mother or the child. So it could be another sibling, it could be the father, an auntie, someone else. So for left-handers, the principle is reversed. So for left-handed, the left side is the partner side, again, anyone other than the mother child. And for the left-hander, the right side is related to mother and child. So that's going to be important because as we talk about cold sore, we look at not only location, but we also look at what side of the body it's on. So for a cold sore, they call it the herpes. It develops in the area of where that separation is experienced. So the one we're going to focus on is on the lip, cold sore. Again, sometimes it's called a fever blister. So anytime it's on the lip, then it's who do we miss kissing or not want to be kissed from? And it also could be, I gave this example when I did the full presentation, because I don't want any parents out there to think that they have their teen or someone else, their spouse has a fever blister that they're going around kissing or missing kissing someone. Not necessarily. It could be, say, for example, your teenager is doing her homework and she has her pencil here and she's doing this thinking. And the mom comes along and says, don't put that pencil on your lip, you know where it was or it has germs. And if it was unexpected, remember the key is always unexpected with these conflicts, then that could be the person's DHS or their separation conflict because it's not only about missing someone, it's about something physically touching. So I have a couple examples. So again, when it's on the lips, it's either a blister, it's a cold sore or fever blister, and we always look at what side it's on. So when I get a call or someone sends me a text, I have a fever blister. What side is it on? you always ask what side it's on, are you left-handed, right-handed, to help to narrow down what that conflict is. But most people know what their conflict is. So I want to share a case with you. There was a 6-year-old right-handed boy who had reoccurring cold sores. And they were always, the mom said they were always on his left side. So since the child is right-handed, we know that it relates to his mother, or he doesn't have a child, could be a pet, possibly, but his mom. In this case, it was his mom. The mom says she's pregnant and her son always wants to come up and give her a kiss. She says she just doesn't feel like dealing with it, so she always turns her face so that he can kiss her on the cheek. So what's the practical solution for this? So for this child who wants to kiss his mom, she can just go ahead and give him that kiss right there on the lip where he wants it, where he's aiming for. And then you can tell him later, okay, mommy wants you to just kiss me on the side, or whatever it is, whatever the reason that she doesn't like or feel comfortable with that, she can explain to him and say, little boys kiss mommy on the cheek. There's going to be some of you who disagree with me, but I'm just coming up with practical solutions for this individual. So some people think it's perfectly normal, there's nothing wrong with it, and and it isn't, it's just a child. So, but for this mom, because this is how she wasn't feeling, she was pregnant, so she didn't want that kiss. So in order to resolve this, give him the kiss that he's asking for. They didn't give him the kiss and then explain to him later. So she did this, she implemented this, and no issues with reoccurring fever blistered. I followed up 6 months later, a year, 2 years, I think up to 6 years, and I stopped. And this, he hadn't had any more after she made that change, that minor change. So I have another case. This is recent. There was a person who had gotten a fever blister. And they knew that it related to, again, physical touch, and they're on the lip, and explaining it related to separation conflict. She knew exactly what the conflict was. So when she shared what it was, she said that her husband was on travel and she was speaking with him, talking to him on the phone, and she heard a sound, mwah, and she got so excited and happy. She said, "Oh, that was so nice. You blew me a kiss or gave me a kiss." And her husband says, "I didn't give you a kiss." And she said, "I heard a noise that sounded like "Sliff." And he said it must have been a noise in the car or in the background noise, but it wasn't a kiss. So that was her unexpected, I guess, letdown. So she stated, since she's aware of GNM, have been learning it, she did get a cold sore and that felt that itchiness, but she instantly realized, okay, I'm going to let it go. She's going to downgrade it. And then after she felt the itchiness, she noticed and watched it over the next few days, but she noticed that it did not go through all of the stages, the fever blister stages where it puffs up, it gets white, like the previous picture we had just seen, and then the oozing, and then the scabbing. It didn't go through all that. It was minor and manageable within a week, maybe a week and a half, and it went away. So I just want to let you know that, again, the fifth biological law, that every so-called disease is part of a significant biological special program that's there to assist us and helping us resolve our conflicts. These are meaningful biological special programs. They're not there to cause harm. They're not something that disease is what we used to assume, that it's due to a virus or some type of herpes and something malfunctioning within our organisms. No, these are there for a biological purpose or reason. So again, how do we think differently? We have to realize that the cold sore was initiated through that unexpected conflict, that shock. Again, a lot of people say, "Hey, have anything traumatic or shocking happen?" We have to look at, to the degree of the conflict will determine the degree of the symptoms and how it plays out. So, and also when we have conflict. So a lot of people say, "Oh, I'm not going to have fever blisters or conflicts anymore." No, we'll still have them. It's just that we can downgrade them because we can't control things that happen to us unexpectedly. So be prepared for them. It's okay, but we can downgrade them so they can be less dramatic or less intense, little, effect on us or again, as in this case, just minor, it didn't blow up, to go through all those full-blown stages as they normally do. So we always think back, look at the timeline. When did it occur? First, before that, we break the association that it has to do with any type of virus or any herpes or anything. So we want to make sure that we look and see, since when have we had it? We think back, what was happening? In this case, this person, since they're familiar with GNM, they know what it is. So you make the conscious connection that my symptoms are related to the DHS that occurred. And when we do this, we get through our healings. So I want to share with you some upcoming events. The first one is the first Thursday of every month, and we have one coming up this Thursday, February 6th at 11:30 a.m. Eastern Standard Time. I will be giving an introduction. So the 5 biological laws, I'll be discussing all 5 biological laws, and it's free. Please register. On Saturday, February, or let me go through this one. So February 11th, we have one at 8 p.m., which is next Tuesday at 8 p.m. Eastern Standard Time. It's going to be on the hearing conflicts, tinnitus, and the cost is $5. And then on Saturday, March 1st, we have an online webinar with Dr. Alvin and Caroline, PhD. The topic is going to be on breast cancer, and it's going to be 30 Canadian dollars. So go register. When you go into the website, it will be there, and you can submit your questions. If you have specific questions about a specific cancer diagnosis, you can submit your questions and they'll be answered. So I look forward to seeing you at any other or additional presentations. And for more cases, if you like these cases, there are more. Dr. Alvin has some. I have a few. I'm in the process of developing more. There are testimonies out there, resources. Go to the Learning GNM website, as well as my website. And I look forward to you continuing your learning journey on GNM. Thanks for stopping in. And if you want to hear more or be notified when more presentations or when I give these short clips, subscribe, and then you'll get a notification. You'll get to watch it. So I hope you enjoyed it, and I hope you enjoy the rest of your night. Take care. Bye.